After this meeting.
You can tell I taught college.
Hey, I think you should take a note.
But Audrey, welcome, Alan. Welcome. I think of you all the time when I go down Green Street.
Oh, yeah. I feel 100% better. The reason I was having all my falls after my surgery, I was getting these times. And
Start the meeting.
he was treating me. I went to a specialist after my serious.
Before we get on to official business, I just want to make sure that everybody knows that you're being recorded. And these are uploaded to YouTube for general viewing and perusal. I also want to remind you, any person may make a video or audio recording of any open session of any meeting, or may transmit the meeting through any medium, subject to reasonable requirements of the chair as to the number, placement, and operation of equipment, used so far as not to interfere with the conduct of the meeting. Any person intending to make such recording shall notify the chair forthwith. All documents referred to, referenced to, or used during the meeting are to be submitted in duplicate to the chair pursuant to the Open Meeting and Public Records Law. All documents shall become part of the official record of the meeting. All right, Mr. Chair.
Okay.
Informally, before we start the meeting, I'd like to introduce Grace Tarkanian. I introduced her a little bit earlier, informally, but now probably a little bit more formal. She's a student at Endicott College in the hospitality industry and is interning at the Gardner Senior Center for the next couple of weeks. Her focus is on events. So we've decided to baptize her by fire and bring her into the Council on Aging. Grace, it's great to be here. This is her first day, so she gets to experience what a board meeting looks like.
Right, we got guys that look at the Wi-Fi. Okay, has everybody looked over the minutes? Mike sent them all out by email, so we've got a chance to go over them.
I move that the minutes be accepted.
Do we have a second on the motion to accept the minutes? Okay, Audrey seconded, okay. Okay, now you can raise your hands.
Any discussion further?
Any discussion?
I have a little question.
Go ahead.
I've noticed that in your agenda, you always put what you basically just said. Right? Did you want me to put those in the minutes so you don't have to say them, or are you going to say them every time?
That's a great question, Kathy. So the question is, since it's written on the agenda, do we have to specifically state in the motion? And the answer is yes. Every motion has to be specific. Lonnie and I talked about this. So when somebody says, you know, I move or I make a motion, you have to specify what that motion is. Because the motion could also be to reject the minutes or reject the report. So if you're moving to accept it, please state, you know, I move to accept the minutes as presented. I move to accept the minutes as amended. Whatever the report is that you're accepting. Great question, Pat. Yeah, the answer is yes, we have to be specific.
Okay, so should I type that in on the minutes?
Yeah, minutes of the December meeting, motion was made and carried to accept the minutes of the December, well, we don't know if it's carried, we're assuming it'll be carried. Oh, no, you don't have to put that in. No, the announcement, no, you don't.
Okay.
Okay, so everybody accepts the minutes?
All in favor?
All in favor? Very well. Minutes accepted.
Any opposed?
Anybody opposed?
He knew that already, but I can
I
say
know.
that.
Still getting used to this. Okay, we can go to treasury report.
I think you all got a copy of the treasurer's report. Did you not? No, you did not.
They did, everybody got a copy of it.
Okay, this is the report as of December 2021, and thanks to Mike, we're able to always get our figures right out at the end of the month. So, right up to date. On the operating account, the city pays us $183,247.64, and you can see the expenses there, and the year-to-date expenses, July to December, because we work on a fiscal year, so we're halfway through, and we have a balance in the money that comes from the city, $104,258.45. So we should be in good shape there. Then we have a gift fund, and the starting balance in July 1 was $49,835.43. And we received a nice gift of $100 from the Gardner family in memory of Maxine Rogers. It was very thoughtful and very nice. And so now, in the gift fund, there's a balance of $49,935.43. And we should send a thank you, or did you already?
Yeah, we
You
did.
took care of that. Okay, thank you. Did go out to the Goss family. We always like to send thank you letters, no matter how small or how great, people like to be thanked. Revolving fund, the beginning balance was $23,531.78, and we received income. You can see it right there, July to December, $13,799, and December, $199. And we had expenses for $5,156.59. So the balance in the revolving fund is now $32,174.19, which is a nice balance. I did have one question on the year-to-date income. Was there any big gift or any big money that came in on that revolving fund?
There is. We're going to talk a little bit more about it, but it's a great question.
Okay.
We received a grant of $10,000 from the Mass Council on Aging. 5,000 of that we received. The other 5,000 we received this month.
Okay, so that was nice. Okay, and then the final account that we have is the state grant. This is money that comes from the state to the COA. And the beginning balance is carryover is $9,618.35. And we expect to receive $49,464.35. Now that grant hasn't been finalized yet, but it's in the works, right? And at the moment, we have a balance, it's a minus $4,055.30. But the city allows us to deficit spend in that account because they know that we will be getting our grant very shortly. And then I think Mike has sent you all these. If you have any questions, you can, he's got it all very nicely itemized for you. The general fund, the gift fund, and the revolving fund, and the state grant. So if you have any questions at all.
I just have one question. On the spelling of the name of the family that made the donation.
G-O-S-S-E. G-O-S-S-E family in memory of Maxine Rogers. And that's it, unless you have questions. And Mike is ready to answer any questions. I think we're financially, we're in good shape, and we're starting the second half of our fiscal year. So, okay, that's my report.
Okay. I'd like to have somebody entertain a motion to accept those minutes.
I'll accept the minutes.
Second. Okay, Audrey, yeah, okay, very
A
good.
report.
Yeah, we're going to accept the report.
The report. That's the report.
Do we have any discussion on it? Okay, no discussions. All in favor?
Aye.
Okay. Very well.
Just a couple side comments. Thank you, Terry, for bringing up the memorial donation. We want to remind folks that that's always welcome and put to good use. Gets put into our gift account for major specific earmarked projects. So if we need a new pool table, for example, or a new piece of equipment, we might use the gift fund, but we haven't used that in the last 2 years. Because we anticipate maybe some big expenses coming up in the next year or two, so it's nice that we're holding that in reserve. Also interesting to know in the city operating account, we had $183,000. We're halfway through the year, and we've only spent $104,000. We've only spent $78,000, so we have $104,000 left. From a percentage basis, we're 50% done the year, but we haven't quite expensed 50% of our budget. I I think that really shows some financial restraint and, kind of a conservative approach, which I think sometimes we need. At the end of the year, there's always unanticipated, unexpected expenses. A note on the revolving fund, Terry already mentioned it, $5,000 of that $13,799 income is earmarked for the senior support program. We're working in collaboration with the CAC. We'll talk a little bit more about that. So really we have kind of unanticipated or anticipated income of about $8,000, which is still really very good. And then the last thing on the state grant, I did speak to EOEA recently, because quite honestly, I thought maybe I missed the notice to submit the signatures, but I didn't, thank God. We have a great contact at EOEA who's been very supportive and let us know the contracts are not ready. It's important to note that the amount that we referenced in our report, Terry, thank you again, that $49,464, is predicated on the 2010 census and this year, and a $10 per senior earmark, if you will, allocation per capita in Gardner, so that's the $49,000. The 2022 grant that we're still anticipating having the contract for will use the same population numbers that were used in the 2021, but will have an increase of about 20%. So it goes to $12 per senior per capita. So we really, although this is the baseline figure from last year, we really expect that number to be a little bit more this year and afford us a little bit more wiggle room in terms of being able to spend money on programs and functions. I do also want to say, we mentioned the Goss family, thank you, those folks that are watching, thank you for making the memory of Miss Rogers so important as to put it in place in history here at the Senior Center. I also want to recognize some folks that did some heavy lifting for the Thanksgiving and Christmas in terms of financial support. So as part of the Treasurer's kind of ancillary report, American Legion donated, the Gardner Lodge of Elks contributed significantly, the Lions Club in Gardner, the Greater Gardner Rotary Club, Chairtown Lumber, Dave Richards Excavating, and Oregon's Cleaners all provided financial support for both our Thanksgiving and Christmas dinners, which was very badly needed because we had to spend money on the takeout containers, warming trays, things like that that were unanticipated and unexpected, and certainly ate through that contribution pretty significantly. So that's just kind of side note. It's not integral to the Treasurer's report, but I figured you might want to know that as a kind of as a sideline. All right, that was all.
Okay. So we're now going to go to old business. And the first one is the COVID update.
So as of December 27th, all city buildings are now under a Board of Health mandate for masks. That's not something new in terms of how we operate. We have been requiring masks for all activities, programs, and functions at the Senior Center, or those sponsored by the Senior Center. So even during the summer outing, for example, we require masks. We have not lifted that mandate here in the center, and will definitely not likely be doing that in the near future. All indications are, and I'll share some very specific statistics, but all indications are in the next 2 weeks, we're going to see a spike in positivity rate. That does not necessarily equate to hospitalizations, although indirectly it does. So I think we can expect much more medical intervention because of COVID over the next couple of weeks. And as a result, we're going to be doing a few things differently here. I want to remind the board that all of our programs and functions are open entirely. So we don't have restricted participation, we're not limiting numbers. I think by virtue of the pandemic itself, that is naturally reducing numbers. We don't have the same, nor does any senior center, have the same participation levels as we did pre-COVID. I think that's just now a normal operating assumption that we have to deal with. We are now working on getting our own disinfecting machine. We borrow it from the police station. We're going to try to get our own here in-house so we can do disinfecting more frequently. But right now, we're just going to maintain what we're doing. We ask our participants to wipe down their chairs, their tables, or whatever surface areas they work with. When they don't, we typically go in, or our instructors go in and do it. The last big thing of the COVID update that I have. Oh, so here's some pretty interesting information. Of 100 tests given on Friday, there were 38 positives. So that would equate to a 38% positivity rate, which is very high. Haywood Hospital and CHC are seeing record number of positive cases among their staff. Why is that important? Because those staff now have to quarantine and can't go to work, which means access to healthcare is going to be restricted significantly in all our doctors' offices. That doesn't mean that it's gone, and people shouldn't panic, but we may see longer wait times for appointments. We may see those non-life-threatening surgeries put off a little bit, and we have to be very sensitive to that for our population, who's the highest utilization of medical services of any population, who have a greater disproportionate amount of comorbidities and frailties. So we're looking at how do we address that, how can we get services into their homes. The outreach coordinator is an important part of that. We have not closed the application process for the outreach coordinator, but once we do, they're probably going to have a heavy lift. The last bit is the COVID kits. I sent that out to you all. We should really take it up under new business for a policy. There are some revisions already to that policy that we'll talk about a little bit later, but we did receive a small supply of home kits. We're working with our partners to develop an appropriate way to distribute those. Pre-Christmas, we received calls from folks that wanted to have home kits to put in stocking stuffers to give as gifts, and really think that's totally irresponsible and inappropriate. However, we understand also there's a high level of anxiety, so we're trying to balance how we meet the mental health needs and the physical health needs of the folks at the senior center. We'll talk a little bit more about the specifics there, but just so you understand that. That is what I have for our COVID update. We just received a new supply of masks from the fire department. We go through about 50 masks a week. So even though we've been kind of having this mandate requiring masks, people are still coming to the center without their masks. They forget that they need them, which is fine, because quite honestly, I get mine, I'll walk halfway into the Walmart store parking lot and realize I have to go back to my truck and get my mask. But we make a supply available. So folks that come in here who don't have the mask, we provide them, and we're doing about 50 a week. That's a package. So we've gone through about 2,000 masks this summer, which is a lot of masks. But thankfully, the city has answered our call, CHC has answered our call, Haywood Hospital has answered our call to get us some more PPE. That's all I have. Any questions on the COVID update? Any thoughts, comments, observations, criticisms? Criticisms are directed to Chairman Ron, by the way.
And I'll give it back to him.
All right.
Okay, next part of order of business for old business is board vacancy. I believe we have a form.
We have a quorum, and we have two folks that have expressed interest. Full disclosure, since the last meeting, we had a very short period in between and the holidays. So Ron and I haven't met, so I would ask for your indulgence, patience, and understanding. We hope to have a recommendation for you by the February meeting. That's okay? Thank you. And once we make a recommendation, the board votes on that, then we send that recommendation to the mayor to make the formal appointment.
Okay, very good. Any questions on that? Explanations? Okay. We'll go down to new business. And we'll go with first the director's report.
Well, there's just been a lot going on. First, let's talk about staffing. As all of you should know, our facilities manager, Rob, lost his mom on Christmas morning. Rob's been out on both personal and bereavement leave. And certainly, on your behalf, we extend our deepest sympathy and condolences, not only to Rob, who we miss dearly this week, but to his family, to his brothers and his dad on this loss. Loss of a parent is one of those kind of big events in life that's really hard to take. So we want to support him, and thank you to the board for for your support in allowing us to bring him a little sympathy arrangement. It was not a little one, it was beautiful, absolutely crazy nice. So I just want to let you know that. Outreach coordinator, we're still waiting on that. We had our first round of interviews, weren't really comfortable with the candidates. They had great experience, great personalities, but just what we're looking for didn't quite match, so we're going to another round of advertising and inviting applications for that job. We decided as a staff to look very carefully at our January and February programs and not schedule a lot, and totally disregarded what we thought, because so many opportunities came in it. So we have a full and robust program going on in January. The reality is we expect the first week in January, this week and next week, to be low attendance in our programs and functions as people just quarantine and stay isolated after the holidays. They should pick back up. But I want to mention a couple important things. On January 12th, we have the Golden Age Club, and they have a magic show. So they promised to make the director disappear. I don't know that they can do it, Gloria. I don't think they can do it.
I was thinking it would cut him in half.
They two for the price of one. That's a great deal. The caregiver support group and the LGBTQI support groups this month are on as scheduled. We are closed the 17th. January 10th, we set a deadline. We're introducing a new program with the support of the Rotary Club of Greater Gardner, the SAM for seniors. So we're accepting, folks' interest up until the 10th. Sign them up, create some maps for distributing that, and distributing a 5-gallon jug of sand salt mixture to folks that are not able to get down to the sand pit themselves and pick that up, or to the DPW sand distribution center. Very, very generous. In fact, when we talk about generosity, I have to mention Arbitron Hardware, who provided the buckets and the lids to us as well. So we're hoping for a pretty good showing on that. Some of our kind of normal programs, which I won't get into, the armchair travel to the Hawaiian Islands. Come and join us. It's going to be great. Brought by Gardner Rehab on the 26th. We'll have some Hawaiian featured food. We'll have a nice display of presentation of the Hawaiian Islands. We're going to do a little bit of hula dancing, so come and be part of that. We'd love to see you tape it and put it on my GBT channel.
Bring your grass skirts.
Bring your grass skirts, right? Thank you. Oh, Hawaiian shirts. February 1st is a big day for us. It starts our tax aid program. Our plan, we've been working with Paul Yude and his crew, great crew to work with, on introducing, providing that service this year. We weren't able to do it last year, as you know, because of COVID restrictions. A week after, no, not even a week after, a day after we met with Paul, AARP came out with all right, pump the brakes a little bit, because we may not be able to do in-person taxes again this year. So we're looking at another model as a backup that provides for people dropping off their materials, getting a photocopy or scan, providing it to the preparer without any in-person, face-to-face contact with those folks. Still waiting for some guidance and final decision on that. I have mistakenly included in the calendar, and I don't honestly know where I got it from, so I apologize. On the 19th, the AARP member meeting and installation. There is no meeting of AARP in January, so that's a typo. We'll send out an email with the updates and the newsletter either this afternoon or first thing tomorrow morning.
Yeah, we don't have anything with the AARP still because of memo we got from the national.
Yep, COVID
rules and all that, so they don't want to have anything in the region, whatever, so it's the whole country.
Is this a Gardner AARP?
It is. Yep.
So if you belong to the national one, you still got to join the Gardner one?
Right.
I believe the answer is yes. And I think you can join the Gardner one without joining the national one. Is that true?
No.
No.
National.
Thank God there's somebody here to set me straight. Yeah, you have to do
You
both.
have to be a member of national, but the dues for the local are only $5.
Yeah, they're not expensive at all. Thank you, Terry, for that. I appreciate it. Ken, great question. Something that I wasn't really paying attention to. I should pay more attention to that. Support money. So we got the $10,000 from Mass Council, Central Mass Council on Aging. We're very appreciative of that. And we want to let you know that we have started to implement that. We're actually working with, rather than recreating the wheel and doing our own intake and validation verification process, we're working in conjunction with the CAC upstairs that already provides medication assistance, fuel assistance, food assistance. So we're going to be working through and with them to identify eligible seniors and leverage our funds a little bit with the funds they get. So hopefully we can maximize the benefit to seniors that are struggling with those essential things. By essential, our conversations from a staff perspective include, supporting the seniors in whatever way is reasonable. So if folks use a cell phone, for example, and they're way behind on their cell phone bill, that would be something that we would consider appropriate. Food assistance, fuel assistance, all the general stuff as well. Credit card bills, not very likely that we would support things like that. So the kind of decisions you can make, that aren't essential, we probably won't support financially. And they're not supported currently upstairs either. So it's nice to have that partnership and support from the CAC. And then the last thing is, and this is a big one, if you want to, we'll do this now under
The listening?
no, the guidelines and
Okay.
distribution. So we might, well, no, let's do it under new business. Yeah, okay, yeah. So we'll finish the director's report.
All right. Do you have anything in the listening session?
So I'd like to start the listening sessions as quick as possible. Last month I kind of talked about the idea, what we'd like to do. Didn't have anybody kind of approach me and say they wanted to do it. But what I'd like to do is have a staff member and a board member. We don't have to have the whole board go to the various sites. So maybe one board member who might be willing and interested in going up to the Hillside Gardens, and have one board member who might be willing to lead the listening session at Banal House, and one senior at the High Rise. There are 4 locations we've identified: Banal, High Rise, Hillside, and Sapphire. Just inviting people to come and attend. And I don't know what the participation will be. It may be no one. It may be 30 people. We don't really know. We are planning on doing some important things to attract people to come, like having food and beverages. That always, for any event, right, even for family events, that tends to bring people gather around food and can converse around food a lot easier. So we'll provide some kind of a snack, a treat for them to come and be part. But if you're interested in co-hosting that with me or a member of the staff in any one of those venues or locations, please let us know. I certainly think it would improve the communication to have a board member there who represents the seniors in our community. Let us know after the meeting.
Okay. So now we're going to go to open discussion.
And the first item on open discussion, if I may, Mr. Chair, make your pleasure. Let's talk about the guidelines for distribution at home COVID-19 testing kits. Earlier, I described the fact that there was no baseline for the distribution in a lot of communities, and Gardner put out a ton, and they did a great job on 2 distribution events. At the end of the last distribution events, they still had some tests left over. So the demand was great, but not so great that it used up all of their supplies. So what I would like to do is really think and be very contemplative about what we do and how we do our distribution. We don't have a lot of kits. We have a small number. So that's the first thing. We couldn't give them out to everyone if we wanted to. But I certainly think that we should, there are some things we have to do, and that is we have to give them and restrict it to only Gardner residents. It came from the Gardner Board of Health, so we can't distribute it outside of the parameters of Gardner, which is too bad because we have seniors that participate from all of our communities, the great Gardner communities, but those communities have received their own and are distributing it through places like their senior center as well. We also want to make sure that we're collecting data. It's nice to have a test, and it's nice to be able to determine whether you're positive or negative, but what do people do with that information after? So one of the things we're really hoping to be able to do is track, manage, and and report on, the data of what we're doing with these tests. So when somebody tests positive, we're asking them to get back to us so that we can track that, give them more psychoeducation materials, like what do they need to do if they're positive? What do they need to do if somebody in the household is positive and they're not? How do you manage those things? And that information is sometimes confusing or not readily available. We hope to be a resource. Just so you all know, this is a heavy lift. Like when we did the vaccine clinics and the booster clinics, that's a heavy lift. And we are hoping to do another one in February if things go well. But right now, nothing on the plan. This will be a heavy lift for us too. But we think it's important to document and then be able to report that out. We will use tracers from Gardner, but the tracing system hasn't been set up yet. So one of the first items in this policy that I've given you is to strike contacting the Board of Health after indication.
I noticed that the blurb they gave you when you picked up those tests at the police station said if you test positive, you don't have to tell anybody.
Yeah, and so the problem with that, and it's easy, and I understand there's no capacity right now. There's no ability, mechanism for the Board of Health to collect that information and disseminate. So I totally understand why they do that. We're asking them to contact us because it's our senior population, and we can start to really ascertain what's the positivity rate among the population that we distribute kits to, and can provide the Board of Health with more meaningful information as a source. But not as an enforcement agency. Again, we're not going to go knock down doors and make people staple masks or do anything like that. It's more for information and being able to report that to other agencies. What we're seeing right now has all, and how we're describing what we're seeing has all been anecdotal, because we haven't been maintaining the database. I will say our healthcare partner in the clinics, both the vaccine clinics and the booster clinics, have been very assertive in terms of documentation, which is nice because when we have a senior that has a problem, we're able to call them and they have all their documentation, which is a great thing. So some of the things that I think are important, that they be over the age of 60, they be a senior who receives services here, that we don't give out tests indiscriminately, that they either have to have been exposed to a known positive in a situation where it was unknown. So that would be like somebody here at an event, or participating in an event, the person who they participate with doesn't know they're positive, they go home, 2 days later they start having symptoms, we would consider that kind of an unknown positive, right? So they had exposure, but they didn't know. I think that's a little bit different than, say, going to a Patriots game and not wearing a mask and saying, oh geez, there might have been somebody there who was positive. There's no real way to ascertain whether they are or aren't. Or be symptomatic of COVID-19. So have any one of those multiple symptoms like gastrointestinal issues, cold type symptoms, that's stuffy nose, drippy nose, cough, sore throat, chills, fever, those kinds of things. So they have to be symptomatic. Or be a household member of someone who's COVID positive or symptomatic. So as a senior citizen, be taking care of a grandson or grandchild, or have their kids living with them and they've tested positive, then we want to provide them the opportunity to get tested. We talked about having close prolonged exposure to a person who tested positive. I've defined that in the policy. Or be a key employee, or be an employee or key volunteer here at the center. So for example, when we had the potential positive exposure by a participant in one of our classes, we wanted to make sure that the instructor, who kind of works on our behalf, is able to get tested, but doesn't live in Gardner. So this affords us the opportunity, and by the way, there are only 2 members of the staff at the Council on Aging and our upstairs neighbor CAC who live in Gardner. All the rest live out of town. So if we said strictly with Gardner people over 60, we wouldn't be able to test them. Then when we do that, we want to give them some education materials. And I made some copies for you just to see what we would like to distribute. Grace this morning put all these little packages together for us. Grace, thank you so much for doing the hard work. And we're doing all this with one of our copiers that is now offline and is not working. So she did a great job. The information includes so the very first thing is a trifold white sheet. You don't have to unstaple them if you don't want to. I'll just explain to you. This is the instructions that come in the kit that have been enhanced. I'm very thankful to the community of Framingham who provided us some copies of their large print editions, and we kind of tweaked it a little bit, but these are the instructions, and they're large print. If you try to read the instructions at the at-home kit and don't have a magnifying glass, I wish you the best of luck. I don't know how people are doing it, so we decided, especially for our seniors, make it a step-by-step, very specific large print edition. This at-home COVID-19 test kit sheet came from the Board of Health. This is what they distributed at their take-home. We figured that was a pretty important piece of information to send as well. On the back of that is just some simple instructions. The kits, each kit comes with 2 tests. And what we've been seeing a lot of, and have been hearing a lot of, is people have acquired the kits, 2 tests. So they give one to their Aunt Hepzibah, and they keep one for themselves. So they give one to their husband or wife, and keep one for themselves. And that's really not what the kits are for. If it was an individual test for individual people, they'd only have 1 test per kit. The 2 tests per kit are meant for a single individual. The first test should be given on day 1 of either noticing the symptoms or having a, it's right there, symptoms or after having a positive exposure. Right, so unknown exposure. Then the idea here is to retest 5 days later. So it's not just because the way COVID works is it doesn't happen in a kind of rifle shot. So you might have been exposed 3 days ago and take a test today and it comes back negative, but it takes 2 to 4 days, 5 days for the virus to show up if you're carrying a viral load. So that first test may absolutely be, useless. And that's why when they split the tests up and they don't take that second test, it's not meaningful. There's really no meaningful result. So we're really making sure people know that they need to use both tests on themselves. And then if they have a positive on that test, or if they have symptoms, they should also call their primary care physician to schedule a PCR test. It's not likely that a at-home kit would test false positive. It's a very, very slim chance of that happening. But there's a much higher chance that a at-home test could give you a false negative. So if folks are symptomatic, if they're experiencing symptoms, they're not feeling well, have them take the test, have them take the at-home test, and then call their doctor for a more indicative PCR lab test. All right? And then just some general information about what to do, at-home quarantine, what that looks like, self-monitoring, just some more information for folks. An update from the Centers of Disease Control on what to do, what the quarantine looks like, and how to do that. So rather than having to go to a web page or get in 15 different sources to look at, we thought we'd give them all this in one package. And it seems like a lot, well, it is a lot, but that's why we're doing it. So that's the information. So we want to make sure every person gets the information, how to administer the test, contact the Gardner Senior Center, contact the primary care physician if there's any symptoms upon indication of any positive result. In this policy, I would like to strike item 2 from information and instructions for recipients to eliminate contacting the Board of Health after indication of any positive test. So there would only be 3 points. And then the last piece of this that's important is also to ask for your permission and your blessing to allow me to use at my discretion the ability to distribute kits kind of outside of these parameters. And I'll give you a really good example. We have a doc in Gardner who does a lot of still at-home care. So they're still doing home visits, which is a rare commodity, so God bless them, including some folks with very serious physical disabilities. They asked for some tests. So we gave them 4 kits so they could test their patients. That would certainly be outside of the realm of the policy criteria that we listed that would afford us the ability to handle those kind of weird situations. Oh, I'm out of breath. Any thoughts? Did anybody have a chance to look at it? Any initial reactions?
I've never heard him say exactly how long it takes you to not be, for the COVID to go away. If you tested positive, how long does it usually take for it to go away?
So the answer to that is up to 9 months. So we asked the same question. We had a person who tested with us and tested positive and asked when they should test again. And the recommendations from infectious disease was at least 90 days, that they will still show a positive, even though they may not be symptomatic or that they may not be contagious. They'll continue to carry that load inside of their own system for at least 3 months. So healthcare providers are requiring a 3 to 4 week window after your last test before they'll reschedule you for an appointment. So, you know, it could be anywhere from a month to 3 months, Ken. And I have to tell you the truth, I don't know the true answer to that, but I do know, again, they're not retesting for 3 months, 90 days.
I was just wondering how long it takes before you're not, you can't give it to somebody
You're not
else.
contagious, yeah. Yeah, I think so far what we've read is that your contagion effect ends at the 14 days. Well, that's what they had said. Now they're saying, geez, you can get back to work in 5 days. The reality is, all of the people we've talked to, and now I know at least 6 people since the holidays that had tested positive, their PCPs are telling them stay with the 10 to 15 days. 5 days is not enough. So I think the CDC has made those changes just based on pressure, you know, need for people to stay at work, and especially in healthcare, that's true. And by the way, that's another major piece, is the 5 days, if you really read the fine print, is indeed for healthcare workers. They say if you're a healthcare worker, 5 days. But everybody else, we still recommend the 10 to 15 days.
I know they're supposed to be updating their statement made up Friday, they're supposed to be updating it today sometime, so I have to watch the news later today, tomorrow morning.
Yeah, every day. It changes, right? It does change.
Dr. Fauci was on television today, he was mentioning that they were updating a little bit.
Yeah, he and I love watching it. I love hearing the information from a lot of sources. It's good info, so kind of stay tuned. Well, any major changes, we'll let you know by email. I'll send that out to you just so that you have an idea. So I am asking, Mr. Chair, that we adopt the guidelines for distribution as presented with the elimination of the requirement to contact the Board of Health after indication of a positive test result.
Okay, we'll vote on that.
Yeah, we'll need a motion to either approve or not approve.
Can I have a motion to approve the new policy that we're going to be using here at the senior center? Okay, Audrey's number 1, okay, good, first. And Kathy, okay, very well. Do we have any people want to, any discussion, make a comment on it?
Just be sure to mention that, number 2 about the contact with the Board of Health. Be sure that is in the motion.
Yeah, that motion. So I'll ask Audrey just to clarify that the motion is to accept with, as amended, eliminating item 2. Yep, all right, so just clarify that.
Now, if I were to catch it and I contacted you, which I would do, and say I've got it, then you would contact the Board of Health?
Yeah, so what we'll do is we'll maintain a database and we'll share that. So we have had some really wonderful support and input from the Board of Health. Lauren Saunders, our Director of Board of Health, has been an incredible resource, as her team has been. Angie, Rick, and crew like that. They've been very responsive and we're so appreciative. We also use the Infectious Disease Control, Joan Doyle, and the Hayward Hospital Group to get feedback and input, as well as the Community Health Connections located at the Mary Kane Building. Those 3, and I think you know our relationship with CHC has been robust in terms of their support of vaccines and boosters. We want to be able to sit at the table and say, this is reality, this is what we're seeing. So we'll really do that one-on-one, so as opposed to a drive-up, hand things out, and have an impersonal conversation. We'll be looking to do one-on-one conversations with folks that are looking for kits to encourage that kind of reporting. The answer is, yeah, we will be reporting. You're not required to, but our idea when we talked to Lauren was that we would provide.
You want as many people, you know, you'd want the system to know how many people have it.
Yeah, and we want to know at our center, what does our population look like in terms of, COVID and, exposure and positivity rate. And the other reason is, it will help us define and develop services in response to that. If we're finding folks have been under-vaccinated, not able to receive boosters, how do we improve that? Can we create an at-home situation? I'm being facetious, but that would help us determine what our response is. And I think another important thing here that they can, to your question, and the question again is, will we report somebody contacts? We encourage people to contact us. And our experience has been over the last 9 months that folks who have participated in programs have subsequently tested positive. We have had no secondary exposures through the center because what we do and ask folks to do is let us know if they test positive at any point in time and have been at the center. Then we specifically reach out to. So we have a very aggressive COVID tracking program. Anybody who's in the same room, same activity, even though they might be socially distanced, we notify and say, hey, somebody in your group, in that program, tested positive. We want to let you know, watch for symptoms. If anything starts to develop, call your doctor. This is what you should do. So that, folks aren't just kind of, out there trying to figure out on their own what to do. And so we encourage that, and I want that message to be clear to our audience, that there's no penalties. We don't say Mike Ellis had COVID, that cruddy old person who's infected. That's not the case. Like, we don't know. We don't know what we don't know. And, I think a lot of people are exposed to COVID and have no idea. They're not doing it intentionally. And so there's no stigma. We don't have any negative repercussions. We don't announce who it is. We will keep that, quiet to the extent that people's identity won't be disclosed. But great question, Ken. Thank you. And let me thank you for letting me explain that a little bit more.
Okay, do we have any other discussions? Anybody bringing anything else up on it? Okay, since there's no discussion, all in favor? Aye. Opposed? Okay, so voted. So we'll have a new policy for our senior center, which is very good.
Yeah.
Thank you for all your work in getting this organized. Okay, and now we're going to have open, well, we just did.
Any other?
Yeah, anything else anybody wants to bring up for topics?
I just had a question about, on the listening sessions, you mentioned 4, did you consider Heritage Village, the one that's on 2A?
Oh, we did, and I apologize. It is, yeah, we did include Heritage Village, yeah, the Turtles, yep. Thank you for.
Where in Heritage Village would you?
So what we're gonna do is send out invitations to folks there and then have a meeting, because there is no meeting hall, and there's no meeting hall at Sapphire Village either. So we'll find a location close by, maybe at the school, which is close to Sapphire, combine Sapphire and Hillside in one.
I'm at Sapphire, and we had, one of our neighbors had a thing during the election for the mayor and so forth, and some of the council people. And they had a meet and greet, and they had a great turnout up there. So, if you could get a resident.
That's a great idea for them, yeah, absolutely.
Open up their home. The only problem is the homes are small, and it's winter time and COVID being what it is. I was just thinking maybe if the weather gets warm, we can have a meet and greet in somebody's yard. I'm there. I can help you out with that.
Thank you.
Somebody goes to the garage, you can open up the garage.
Well, that's it too, yeah.
Something like that.
It'll be a quick meeting, but it'll be a meeting.
Yeah, but I'm just thinking, because the houses are small, people worry about COVID, and we do have a Facebook group just for residents too. So I can get the word out as far as that goes, as far as, promoting it.
Oh, that'd be terrific.
So I'll be more than happy to work with Sapphire. I've been here 6 years, so.
Where is Sapphire located?
That's up past Dunn State, off of Pearl Street, but on the opposite side. So
Oh, okay.
Up by 140.
Okay.
There's a whole subdivision up there.
Well, that's houses though, right?
Yes,
Yeah.
they're 55 plus houses.
Yeah.
They're manufactured, they're on a slab.
Yeah.
like sort of like what Heritage is like that. So I'm more than happy to help you out with that.
I've been in Gardner for over 35 years, and I've worked in the community a lot, and I never knew that was called Sapphire Village until I started working here.
Neither did I. And I've been there a
Oh,
lot longer.
thank God, I don't feel so bad. I was like, oh, but, you know, people talk about it. What the heck is that? Well, thank you for that invite.
And the interesting thing is the mayor lives on Pearl Street between two streets in our neighborhood, right? So we had a water main break there a couple weeks ago, and I always said it's always good to have a water main break in the same neighborhood where the mayor is. And it was fixed right away.
Okay, anything else for discussion?
So what's the listening session about? See, I missed last month's meeting.
Yeah, great question. The idea here is, some folks call it a, you know, kind of like the beginning of a strategic planning session. What we want to do is just get some folks together who are in our service age category, who may or may not use the senior center, but talk about, all right, what are we doing well, what are we not doing well, what are some ways we can increase our interactions with seniors, so what are some new, what are some things people need that will afford us the opportunity to develop new programs and responses to that. The model at the center is a great model, and it works well for those that are connected. It works very well for those that are connected. It gives them the social interaction, the, you know, the fellowship, food, and, you know, support. But the reality is the vast majority of seniors in our community are not connected to the senior center. So, you know, they may not be bridge or pitch players. What are the other things we can do to get them here? And when they're here, or when we engage with them, we can certainly go out to the community. We don't have to be within the confines of four walls. What are the things they want? What are the things that they need that we can deliver?
Good idea.
That $10,000 per senior that you were talking about.
$10,000 per senior?
Well, no, that's the amount that you, no, the amount that you have for, is that for the whole city, or
It
is that
is.
just for the senior center?
Yeah, it's for seniors that are 60 years of age or older. Yep, so it's not just for people who are engaged at the senior center. And I think that's a really important remark, because none of the services here are limited to folks that come into our doors. Whether it's our ability to hook them up with transportation through MART at CAC, whether it's, you know, they're coming in for tax assistance or prescription assistance or Medicare counseling through our SHINE counselor, Integrity Medicare advisors, information sessions. They're open to they're actually open to anyone, but we drive our programs so that they're specific to folks that are in the older age groups. So if somebody who's 35 could come into a session on Blue Cross Blue Shield, but it wouldn't have any relevance to them because they're not eligible for Medicare yet. So that great question. That money is not limited to just seniors. And by the way, just another point of clarification, if it was $10,000 per senior, I am technically a senior now. I would have applied for it first. No,
It's the amount that the senior center gets.
we don't normally get it. This was a special gift and award. We in fact had a listening session in, who was here?
Was it Vegas?
Ron Terry. Yep. You did it third. Somebody else did it.
Just like that, the director, or his title was, he said to Mike, we're giving you a grant of $10,000, just like that.
Yeah. He says, what do you need? I said, oh, geez, you know, being a little funny, you know, money to help pay for this stuff. He said, okay, you got it, $10,000. Is that all right?
And we got 5,000 already.
Yep,
And
5,000.
they will be coming sometime later in the year.
Yeah, they should be coming this month.
There we go. We'll be all set.
And this is, I think, the toughest time for seniors, January, February, March, with fuel, and if it's a particularly troublesome winter, you know, hiring folks to shovel their driveway even, right? That extra $25 out of their wallet is a lot of money. Everything's going that well.
Okay. Since nobody else has anything to discuss, nothing else to bring up? Oh,
Oh, what are these for?
So you each got one of those packets. It's from Aging Services of North Central Mass. It is our elder abuse protection, so if you want to have that. We are a mandated reporter. The Gardner Senior Center staff, all of us are mandated reporters. You don't have to go through the same training, but if we see elder abuse in any way, shape, or form, this gives you the opportunity to look at what does elder abuse mean? What does it look like? What are some practical solutions to or resolutions of elder abuse? And I was talking to an elder about elder abuse in the training we had, and they're like, well, aren't people reluctant to report it? Because let's say that their kid is maybe abused in the relationship and taking money, or might have anger issues or things like that. They would be afraid that somebody would come in and remove them. That's not what they do. They look at every practical possible solution to making that elder safe and healthy and secure without disrupting their life. So I think that's a really important thing for folks that are watching and for folks we talk to know and understand that if something is happening that isn't quite right, that we are a resource for them. We can help them set up somebody to help do their finances, provide a financial counselor or a guardian, power of attorney to handle those matters, so that it removes the person that they have a relationship with from being kind of put in that very kind of difficult, I think, position sometimes for folks that are struggling, right? So let's take that temptation away. Still allow that person to interact with and be engaged in our seniors' lives. And that's what we hope to do. So check it out. It's just some materials. We will probably have Aging Services came in and did an in-service for all our staff on elder protection. We did that in October, November. We'll probably have them come in and do a session with the board as well, so you know and understand what our staff does on a kind of daily basis to ascertain, determine, and then assist our seniors who may be struggling in some way, shape, or form with somebody they have a relationship with.
That might be a good thing to put on the senior moments.
Yeah, it would absolutely be a great thing to come on Senior Moments, and we have our woman scheduled. Well, we have her agreements being scheduled. We don't have her on the schedule yet, so they're just looking at their schedule. Yeah, great suggestion.
I have one thing I want to bring up. It just came to my mind, looking at the date from the next meeting. Going to be last week, I believe it was, the week we had the Christmas party. We were delayed 2 hours. We know the policy here is we follow the school policy. So the schools are closed already. We are closed here already. But like there was no school the other last week, and we were just closed for 2 hours.
So our policy, our cancellation and closure policy, is an interesting one. While school is in session, we follow the school's calendar for whether or not the building is open to programs and services for folks that are coming in. That doesn't mean staff. So even though there might be a snow day for schools, we're not school staff. We don't fall under the school staff category. The staff still has to come in. Now, the manager and director, there has to be a little bit of discretion in that, and I'm not going to have on a blizzard day have staff drive from Athol. But generally, if the situations were that bad, City Hall would be closed as well. So for staff, we follow City Hall schedule. Last week, when we closed on the Christmas meal day, that Wednesday, City Hall had a 2-hour delay. So we followed City Hall's guidance on that. A week later, the Tuesday between Christmas and New Year's, it was wicked icy. So City Hall did not have a 2-hour delay, but we implemented one. And we typically, we posted that Monday afternoon, so we'll post on Facebook, we'll spread the word on Facebook. We post on our website, our city website, and we also announce it on our phone system. You guys have heard me say this 100 times, I'm going to say it again. I'm so appreciative of the mayor for his support and for Bob O'Keefe for making it happen so quick on the installation of the new phone system. Because 6 months ago, in order to put that message out there for seniors who were calling here, somebody had to come in during inclement weather, record the message, and then leave. We're now able to do all this remotely. So we can set a message up literally in 5 minutes to change the dynamic. So folks can call in, and they have an option button. They can click one, not have to listen to a 40-minute message, click one, and they get weather and cancellations and program updates. Click through, they get mic out. So it's just, it has changed the way we work at the senior center. We can do a lot more, our staff has a lot more time, technology has seriously improved our lives, and I'm so grateful as the director here for that support of our staff. So it's really been good. So those are the three ways we communicate it. If people aren't on the website, if they don't use technology, they can always call in and click one for an update on the messages, and those are real time. So, you know, if at 11 o'clock we determine the weather's going to be bad, we can change it at 11 o'clock, then folks can just call in the morning and see if the program's going on.
Okay. Guess we'll be going for adjournment, but before we do that, I'm just gonna let you know that our next meeting will be on Monday, the 7th of February at 2 o'clock in the afternoon. Provided you're on the slow side. So, okay, do I have a motion to adjourn?
I'll make the motion to. I second it.
I do second it, okay, very good. All in favor?
Aye.
Aye, okay. So, no be.
Thank you all, appreciate your time.
Thank you for coming.
Feel free to harass Grace on your way out.